this is the most important part of the Norma Basalis. Most important. So guys, clock it for your VIVA. Just clock it. Guys, clock it. The structures passing through the foramen vein. Then memorize. Welcome students for the part 2 of Norma Basalis, the middle part. This middle part extends from the posterior free margin of hard palate here and up to the anterior margin of foramen magnum. So this whole area is the middle part of Norma Basalis. So coming on to the midline, these are the median structures of the Norma Basalis. This whole aperture is called the posterior nasal aperture, and we can see it is divided by a bone. This is called the vomer bone, which has this broad base and processes which is going towards sphenoid, and these processes are called as ala of vomer. And from the palatine bone, as we can see here, right here, yes, so this is, we can easily appreciate, this is the sphenoidal process of palatine bone, and underneath we have the ala of vomer bone. So in between the two, can we see this canal, palato-vaginal canal, and this one, this is vomerovaginal canal. This is the most important part of the Norma Basalis. Most important. So guys, clock it for your VIVA. So just clocked it. So then we move towards the lateral aspect of the middle part of Norma Basalis. We can see two pterygoid plates. This is the medial pterygoid plate and the lateral pterygoid plate. Medial pterygoid plate inferiorly has this bony extension called as pterygoid gemellus. This is pterygoid gemellus, and superiorly it is having a triangular fossa. This is called scaphoid fossa. Superior to that, we have this canal. This is called pterygoid canal, and in the pterygoid canal, nerve and artery to pterygoid canal is passing through it. These two pterygoid plates is separated by a fossa here. This is called the pterygoid fossa. Coming on to the lateral pterygoid plate, this is the two. These are the two surfaces of lateral pterygoid plate. This is lateral surface, which is forming the medial wall of infratemporal fossa, like this. This is the infratemporal fossa. This is the medial wall formed by lateral surface of lateral pterygoid plate, and here this is the medial surface of lateral pterygoid plate. In the middle of lateral pterygoid plate, we can see a spinous process. This is called pterygospinous process. Move further lateral, then we can see this surface. This is the greater wing of sphenoid, which is forming the roof of infratemporal fossa. Again, we will make this infratemporal fossa. This surface will form the roof of infratemporal fossa. It has 5 margin. Here we can see 1, 2, 3, 4, and 5. So we have, this is the greater wing of sphenoid. 1, 2, 3, 4, and 5. So this margin is forming the infraorbital fissure here. This is forming the infratemporal crest. This forms a suture with the squamous part of temporal bone. This margin is merged with the pterygoid plates, as we can see here. And the most important margin, this one. So guys, clock this movement. This is the most important for your VIVA. This is having two foramens. This is oval shaped foramen, foramen ovale, and this is the round foramen. This is called the foramen spinosum. So why we call this foramen spinosum? Because right behind the foramen spinosum, it has the spine of sphenoid bone. This is the spine of sphenoid bone. So we have spine of sphenoid bone here. Anterior to that, we have the foramen spinosum. Then anterior to that, we have foramen ovale. Sometimes we can see a foramen between here, the scaphoid fossa and the foramen ovale. This is called foramen of Vesalius. Sometimes we can see another foramen present between these two foramens. This is called canalicunus innominatus. Guys, clock it. The structures passing through the foramen ovale. Then memorize the structure passing through the ovale is the male. M for mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, and E for emissary veins. So these four structures, M, A, L, E, are passing through the ovale. So we always say male through the ovale, male through the ovale. From the foramen spinosum, nervus spinosum. It is the recurrent meningeal branch of the mandibular nerve. and also the middle meningeal arteries passing through the foramen spinosum. This is mandibular fossa formed by the squamous part of temporal bone. This is petrous part of temporal bone. This is the apex, and this forms a foramen called as foramen lacerum. Why it is called lacerum? Because it has lacerated margins on the petrous part of temporal bone. This is called carotid canal. You can see this is called carotid canal, and as per the name suggests, internal carotid artery is getting entry into the cranial cavity right here. It is getting entry into the cranial cavity. Posterior to that, a long triangular process. This is called styloid process. Three muscles and two ligaments are attached to the styloid process. Posterior to that, this is the mastoid process. This is styloid process. This is mastoid process. In between the two, this is stylomastoid foramen, out of which facial nerve is coming out. So these are the points. Clock it, guys. Now coming to the later most part. So there is a fissure which is divided by a bony plate from the petrous part of temporal bone. So it divides this fissure into two parts. One is toward the squamous part of the temporal bone. So if we call that petrosquamous, and another is towards the tympanic plate, we call as petrotympanic part. The area between the petrous part of temporal bone and the basilar part of occipital bone, this lodges the eustachian tube, and that is why this is called the sulcus tubae. This area is called sulcus tubae, very important for the viva. So again, you can clock it this. This is about the part 2 of Norma Basalis. Stay tuned for part 3. Thanks for listening. Clock it, guys. Bye.